Let's look at antitussive, expectorants, and mucolytics. These are three classes of drugs to treat cough. Cough are of two types, non-productive or productive. Productive cough, patients will have a lot of mucus secretion. That's why it's also called wet cough. And the other one, not much mucus secretion. Therefore, it's also called dry cough. Keep in mind, this cough is due to some of the underlying disease condition. So as a physician, it is very important for you to find out what is the reason for the patient's cough. Then only think about treating the cough, okay? And of course, if you even after treating the patient's disease condition, if you cannot control, you can use these cough medications to control the cough, okay? So why is it significant? In dry cough, what happened is, if you keep it untreated, this can damage the patient's airway mucosa. Remember, in the airway, you have the pseudo-stratified columnar epithelial cells there, right? So these cells will be damaged, therefore, we need to treat that condition. The second one, the wet cough, the patients get a lot of difficulty in breathing. That's also dangerous. Therefore, it is significant to use these drugs. So there are only 3 classes of drugs and only 6 drugs to learn from this lecture. Okay, it's a very easy lecture. I think it is the easiest in the pharmacology. So the expectorants and mucolytics classes are together called mucokinetic drugs. And first, antitussive, the 3 drugs you need to learn. Benzonatate, this is actually a non-narcotic cough medication, a benzoate ester. And the second one, codeine, is an alkaloid prepared from opium. And the third one, methyl-containing phenanthrene called dextromethorphan. Expectorants, you need to learn only one drug. It is called guaifenesin. This is an ether of guaiacol and glycine. The mucolytics, there are 2 major drugs to learn. First one is N-acetylcysteine, commonly called NAC, and Dornase alpha. So let's look at the antitussives, the first class, okay? So antitussives are drugs for symptomatic relief of cough. This has a mnemonic, easy for you to remember. Antitussives A and B, C, and D are 3 drugs, okay? So cough drugs act differently. First, one of these 3 drugs works on peripheral part of the nervous system, and the other 2 drugs centrally. So peripherally acting drug is benzonatate, and centrally acting are codeine and dextromethorphan. And centrally acting one actually decreased directly acting on the brain's cough center. This decreased the activity of the cough center. The cough reflex will be decreasing, but the peripherally acting one decrease the cough reflex by acting on the peripheral vagus nerve, okay? And the centrally acting drugs codeine and dextromethorphan is also called narcotic and non-narcotic agents. So let's look at benzonatate first. Benzonatate is a peripherally acting non-narcotic antitussive, and it is indicated for cough. How this drug work? So keep in mind, this drug is actually desensitizing the stretch receptors in the respiratory passages, lungs, and pleura. So how is going to work? So remember, breathing is essential for the survival and is under precise neuronal control. That is why 10th cranial nerve, vagus nerve, provide the major sensory innervation of the lungs and mediates basic physiological functions in breathing control. So here, benzonatate is actually a drug which is structurally resembling the procaine. You remember the local anesthetic, procaine and tetracaine? These are from the class para-aminobenzoic acid. Because of the structural similarity, similar to procaine and those local anesthetic, this is targeting the same sodium channel. So benzonatate going to block the sodium channels. Therefore, It inhibits the transmission of impulse from bronchi and alveoli ending via the vagus nerve. This thus reduces the cough reflex. Okay, easy to remember. When you talk about pharmacokinetics of benzonatate, there is not much to remember, only 3 points. Keep in mind, this is an oral drug, both over the counter and prescription medications are available. This is actually a fancy looking gel like a liquid filled capsule with a paraben. It's not recommended for children under 6 years of age and not chewable. It can numb throat and tongue because it work like a local anesthetics. That is the reason. And also it is very important for you to recommend the patients to know to chew. The reason, if they bite, especially when they are eating and drinking during that time, the numbness, they can break the tongue and lips. So it is very important for you to recommend this to patient. Make sure to stop if they feel numbness. Make sure not to eat and drink during that time. Okay, that's a very important point to remember. Then another point, it's a very fast acting drug. It's effective within about 15 to 20 minutes. It lasts up to 3 to 8 hours. And if a patient is taking in recommended dosage, there is no respiratory suppression or anything. This drug is metabolized by hydrolyzation by plasma butyryl cholinesterase. This is nothing to memorize or anything, but keep in mind this is important for one reason. Let's look at it. Benzonatate metabolized by the plasma enzyme into BABA, that is 4-butylaminobenzoic acid. In some patients, the cholinesterase level is actually high or low. In that case, they should be concerned about increase or decreased level of drug in those patients. That means the active action may be variable or also the adverse effects. That's why. Other than that, nothing much to remember about the pharmacokinetics. About adverse effects, this is actually a well tolerated drug. If a patient is taking a drug in a couple of days, there is no problem. But if they are taking more than a week, the side effect can increase. In addition to the GI upset, constipation, and nausea, the major, commonly found adverse effect is sedation. Patients get mild dizziness and drowsiness because of that function. Remember, this drug work by blocking the sodium channel, right? That's the reason this can be possible. Mixing with the alcohol and related drugs will be increase the risk of drowsiness. And although it is not prone to drug misuse or abuse, benzonatate associated with a risk of severe toxicity and overdose, especially in children. And toxicity can lead to cardiac arrest also. And it is also not to use, keep in mind, benzonatate is not to treat asthma, COPD, or pneumonia. Although asthma-related cough can be controlled by asthma-specific medications, both prescription and over-the-counter antitussives are often necessary. Okay, that's a simple point to remember. And in benzonatate, there is much to remember. Only two things most commonly a board exam and class exams will ask: indication and mechanism of action. And you need to remember which class of drug.